OsteoSignal, Episode 16. This is OsteoSignal with Neil D. O'Neill, a podcast exploring how your body's natural design connects with osteopathic science, translating complex signals into practical insights so you can truly thrive.
Welcome back. I'm Neil O'Neill, osteopathically trained manual physical therapist, and joining me today are...
I'm Autumn Mayberry, and I am an osteopathically trained manual therapist in Utah and one of Neil's students.
Hi there, I'm Brent Mayberry. I'm Autumn's husband, and I'm just here to ask questions from a layperson's perspective and try to help us get the most out of the information that Neil's going to present. So Neil, what are we talking about today?
So, what if I told you that scientists extended the lifespan of extremely old male mice by 70%? Not by gene therapy, not by CRISPR, not by fasting, peptides, or cold plunges, but with two already available molecules, oxytocin and an ALK5 inhibitor, that together restored youthful protein patterns, improved agility, enhanced memory, and nearly tripled the odds of surviving later in life. And here's the twist. It worked in male mice only. Females showed short-term improvement, but no extension of lifespan or long-term biological rejuvenation. So today we're diving into what this treatment actually did, why only males responded, and how manual osteopathy through mechanotransduction and fluid fascial regulation may intersect with the same biological pathways this drug combo modulates. This is where osteopathic science meets modern longevity. Let's get into it.
Okay, all right, that sounds like a fascinating study. You sent it over and I was looking at it a little bit, and that's a really fascinating combo. Can you maybe explain what is it ALK5?
Yes,
the inhibitor. I think all of us are familiar with oxytocin. It's a hormone, right? If I'm correct, that helps with bonding between people and that has some other effects on the body, right?
Yes. So
maybe we could talk about that first.
Right. So oxytocin, otherwise known as vasopressin, is the hug hormone. So it's naturally occurring in humans. Humans produce that, and more in response to human touch. It's also known as an antidiuretic hormone, so that it keeps you from. It's produced in the hypothalamus, released by the pituitary gland to regulate water retention, urine concentration, and blood pressure. So it's very important in a lot of areas. It increases water reabsorption in the kidneys and constricts the blood vessels. So it can raise your blood pressure. So if you have too much of it or it's not regulated appropriately, well, what's one of the big causes of male death later in life? Cardiovascular disease and high blood pressure from, causing stroke, pulmonary embolism, and myocardial infarction or other infarctions, other blood clots in other places. So clinically, we use it to treat a few different things, vasodilatory shock, diabetes insipidus, which is a problem with the kidneys when they're not responding, GI bleeds. So it's a very, very important drug, hormone. And it's made in response to human contact, right? So it's good and bad. So the regulation of it needs to be improved is what we're really looking at here.
Men need more hugs is what you're saying.
Everyone needs more hugs, exactly. Hug your kids more.
Yeah, there you go.
So, and what this did is, so what they were doing is they were looking at older male mice, and these older male mice, meaning that they were 25 months old, which is about equivalent to a 70-year-old male. And so they were looking at these mice, and they were like, hey, as these mice are aging and they're about to die, age out, we want to know, is there something we can do to them that might just make them healthier? And so what they did is they used a combination of the vasopressin or oxytocin and then what's called an ALK5 inhibitor. And so that combination, and they're both polypeptides, and polypeptides, proteins are very large molecules that have lots of what's it called? Amino acids.
Amino acids.
So so they have tons of amino acids, usually more on the order of thousands of amino acids. Can be a couple hundred, but usually at least 200 to 500 is a kind of a minimum. So a polypeptide is going to be something that has a number of peptides, which are partial proteins, anywhere on the order from 2 amino acids to say up to 500 peptide or amino acids. So, and what we see with a peptide is that a peptide and a protein, the peptide attaches into a protein, and it changes how that protein is folded, and therefore changes how the protein functions, right? And so that changes function. So we use those as neurotransmitters mostly. So here you have these polypeptides, and you use these two in what we would really call at this point an aged system that has become dysregulated and that is starting to have problems. It's starting to break down, right? And these mice are heading towards death. So what the researchers found is that if they use these two polypeptides to help regulate the mouse's system, they found that it actually restored health to the male mouse. Now, here's the thing: these male mice were at about age 70, 75, relative to humans. Yeah, so it's about 75 human years. 25 mouse months equals 75 human years, and so that's pretty aged. And so they increased their lifespan by 70%. Well, the expected your life expectancy at 75 is not huge, right? It's just a few years. So to increase that by 70% means that you increased it by a very small amount overall, right? So it's not like it gave them 20 extra years. However, it took a time in life where you really gave them better quality of life and improved their lifespan in that short period of time. So it's not like it's not a fountain of youth here. However, it is something that obviously these companies are looking for. Hey, what can we give to older people to help them regulate and be healthier in their later years, so that they can be active and enjoy their few remaining years as their life comes to an end. So it is important, but it also opens up a window and a pathway to understanding, like, what's going on in systems, like especially as they age and as they break down. Well, we see that really, particularly with males more than females, that there's a big hormone dysregulation, right? And there's a lot of inflammation, and that inflammation gets in the way of the signaling of these polypeptides. So in females, you don't have as much inflammation because they have the protection of estrogen much later into life. So we're not going to see as big of a difference, because the amount of time that the females have had that kind of inflammation in their system hasn't been as long, right? From menopause, or what we call andropause in a mouse, or mousopause. There we go. So mousopause is going to occur, and then from that point on, that mouse's system starts aging, becoming more inflamed, losing the signal, right? Losing the signaling of hormones. So for female mice, it's going to be a much shorter window, whereas the male mice, their whole lives have been far more pro-inflammatory, right? So they also are going to go through a form of menopause, andropause. And so when they go through that andropause, what we're going to see is that we see a much bigger dysregulation of inflammation and signaling, polypeptide signaling, neurotransmitter signaling, hormonal signaling. That's why the male mice had a much bigger change, right? We see a much greater effects. That doesn't mean that there aren't some of the females that are also going to have that inflammation, right? As with humans, there are some women who do not make it to live older than men. They die young as well. So there are going to be some people in the population where you see this change. So that was the goal. That's what they're looking at. That's the understanding that's necessary. So from our standpoint, as manual osteopathically trained therapists, we work with the autonomic nervous system and what we call the neurohormonal axis. The neurohormonal axis really is the hypothalamus and pituitary, where these chemicals are produced, and the signaling of that throughout the body. Our job is to get rid of inflammation and to make the body work better. So a lot of what we're doing is going to cause exactly this same sort of improvement in. It's not going, it might not give the person an extra 20 years, but it's going to take the time they have remaining from wherever we begin our treatment to the end of their life, that it's going to improve their signaling, their control of inflammation, because we do stimulate exactly those systems. And that has been shown, that stimulation of the neurohormonal axis and stimulation of hormones particularly. So that's really what we're doing with manual.
Can I just jump in and say, have you, I think you've taught this in some of your classes. Right? Am I correct in assuming
this
that?
is a big basis of what we teach.
Okay, could you maybe just name a couple of the classes in which these techniques are used to manipulate that neurohormonal hormonal axis?
Yeah, certainly. So we have taught this. We certainly teach Arbuckles, Bennett's, Chapman's. Those classes, those are all, well, two of those are osteopathic physicians. One was actually a chiropractor, but they all studied that aspect of the human body, inflammation and signaling back and forth. We also teach a vagus class, a class on vagus. We any of our cranial classes, any of our higher level courses, we have a lot of higher level courses, and they're listed out on our website. Uh,
A lot of the
uh,
visceral classes have it too.
oh, the visceral classes, right? We're getting ready to
Hmm.
teach that class in a week here, and yeah,
Next
that
week.
right next week. And so we talk about this neurohormonal axis, and then we approach treating it from several different directions, like the visceral classes. We have 1, 2, 3, and 4. We have how to attack that from a neurological process, from a biomechanical process, a cranial process. So, yeah, those are the classes we teach that sort of approach in, and would be exactly pertinent to exactly what we're talking about right now. That's
All right, awesome. Sorry for derailing you, but I just wanted to let our listeners know that the stuff that Neil's presenting now is that where he's applying it, he's using it right now.
Have
To
been for a
teach
long
other,
time.
yeah, to teach others
Yeah.
how to use it. So this is great info. So thank you for that. Let's keep
yes.
going.
Okay, so kind of getting back to these, our main thing was that UC Berkeley is the one, they did the research. They showed that oxytocin, and a tissue repair and pro-social hormone that declines with age, right? And an ALK5 inhibitor, a blocker of the TGF. Um, we used to say TGF was a tumor growth factor, but now we call it a transforming growth factor. It's the transforming growth factor beta signaling pathway. That's not overly important, which becomes overactive with aging and drives chronic inflammation. It drives fibrosis. It inhibits stem cell repair, right? And it increases cellular noise, cellular signaling noise. So that's really where the problems come in. You have too much ALK5 inhibitor and not enough oxytocin. And so really the system starts kind of going off the rails and not functioning properly. So by reducing TGF beta and restoring oxytocin signaling, the researchers essentially rebooted the internal environment of the old tissues. And the results of the male mice, 73% longer remaining lifespan, 14% increase in median lifespan, better endurance, better agility, better memory, youth-like protein signaling, and reduce their biological noise. In other words, the signals that they were producing in other places worked better. So they were healthier is really what we're trying to say here. They started to thrive again, as opposed to just aging down and winding down and falling apart. They actually kind of perked back up and were thriving. Now the
Awesome.
results in
Sorry, let me
go
just to clarify. So the ALK5 inhibitor, the body, was it endogenously produced too much? And
yes.
it was blocking the TGF beta
Yes.
pathway?
Yes, exactly what happens. And
Okay.
it blocks a lot of things because it increases all that noise. So it blocks this transforming growth factor. The transforming growth factor actually takes stem cells and tells them, "Hey, heal the body. Hey, do this.
I see.
Keep this healthy. How do we keep right?" And that's what your neurohormonal axis, or really does. Your HIPAA axis, as it's also called, the hypothalamus pituitary adrenal gonadal axis. There's more organs in it than that, but that's a convenient way to describe it. That axis is supposed to keep your tissues younger and vibrant and healthy, and so thriving. And what happens over time is you get more inflammation. You stop producing as much oxytocin, partially because you're producing too much ALK5 inhibitor, which blocks that signaling pathway and just leads to chronic inflammation, fibrosis, shuts down those stem cells, increases that cellular noise so that the body parts can't all communicate with each other, including the gonads, right? Like people are taking testosterone, people of all sorts are taking hormone replacement therapy of one sort or another, and getting a large benefit from it. Well, what if you didn't have to take that? Especially, we see a lot of problems with the synthetic hormones. You see that right now, that a lot of men who had been taking synthetic hormone had all sorts of problems, and women were taking that as well. So now they're trying to move more towards a natural form of that. Well, what would be even better than that is if you produced your own, and the amount that you produced had a clear signal and a clear effect. And so by
Could go
removing,
where it needs to go. Yeah.
go
All right.
where it needs to go, do what it needs to do. Okay.
Okay,
So that,
I asked because it looked like the paper was saying that they were trying to block TGF beta instead of like restore it. So I just wanted to clarify.
yeah, right. They were they were blocking the blocker is really what it was.
Oh, okay, gotcha.
Yeah.
All right,
Block.
sorry. And then
Yeah.
Double
so
negatives.
Right.
yeah. So what happened with female mice?
So females, right? Obviously, I'm sure many of our listeners would like to know. Well, there were short-term improvements. There was no overall sustained rejuvenation. But again, remember when we're looking at males and females, especially after about the age of 75, there's not a whole lot of hope for guys at that point. It's really winding down for guys for their life expectation. Whereas women, there's a lot of expectation of health and continued, uh, good years of living. So it didn't really extend their lifespan. Uh, maybe exciting, maybe not for the ladies who are listening. It improved fertility in middle-aged females. Now, that's great because there are a lot of people out there who are later in life and now just trying to have children, and they're going through all sorts of uh, processes that are very expensive. So a very simple process that might help with that improved fertility could just be this process. But that also goes back to what we do as manual therapists is like we're trying to fine tune that system all the time. And for the people that come to the classes, we really focus on seeing that, making a change, both in the brain and the neck, various places in the sympathetic nervous system and the parasympathetic/vagal system, and then observing those changes as a feedback mechanism for, do we need more treatment? Do we need less treatment? Where do we go with our treatment? Right. So the treatment itself is not indirected. It's not just hodgepodge. It's very directed work. So even females would benefit from this. They might not get more years, but if especially females in the middle age years, that they could have improved fertility. Okay, that would be very useful. But it's a fascinating commentary on the sex differences and the sex divergence of aging. So very important that way. Okay, so why only in males, right? That is the $1 million question. You kind of answered that, but obviously the full picture is not entirely known, but several mechanisms always stand out that we want to be a little more specific about. So sex-specific TGF beta regulation. Females naturally have stronger baseline TGF beta modulation, influenced by estrogen and estradiol-related receptor pathways. I've kind of hinted at that before. If the pathway isn't dysregulated in the same way in old males, blocking ALK5 may produce fewer benefits. And, again, most women have a strong protection from estrogen, estradiol. Some women will not have that. So there are going to be some women. Now, I can kind of guarantee you, as Autumn can attest, we won't normally call those patients. The people who are having problems are coming to us, right? So men they get stiffer quicker. And they also have just more problems at an advanced, they have more advanced problems at a younger age. So that's a problem. More TGF beta driven inflammation with age. Women have more immune complexity and resilience. Though I will point out now, the study didn't have a chance to really look at this. I mean, obviously this is an initial study. How does that change autoimmunity, which we all know that females suffer from more than males? Well, they didn't really go into that, but I think that's where follow-up research is going to go. They're going to say, well, we didn't extend the females' lives, but again, we made their lives better. We improved the quality of their life, especially if we down-regulate autoimmune problems. Okay, so and again, this is a model for, well, what is it that we do in manual osteopathic therapy? We're looking at these things, and this is exactly what drives our work. So very, very exciting on the one hand, certainly for us. So oxytocin signaling is sex dimorphic. Men show a large anabolic and anti-inflammatory response to oxytocin. A guy doesn't need very many hugs to feel better. Women show a larger reproductive axis response. This may explain why middle-aged females became more fertile, but did not live longer. Also, women are going to show a larger reproductive axis, and we all have seen this we've all seen this in action, right? So when someone's had a baby, and a woman starts holding that baby, and all of a sudden she starts looking at her husband, going, "Maybe we need one of these," and the guy's like, "No."
It never goes away.
Right. We already see this difference. I mean, in some ways you could guess at this difference and going, yeah, a woman holds a baby for a short period of time. And all of a sudden, and some women even like begin lactation again, and start having to go, hey, what's going on? So their system, just from that vasopressin or that oxytocin, already starts kicking over with this. So that hug reflex kicks in and starts having its action. But we want to do more of that, and we want it to be focused and directed. So, okay, so more information about that. Muscle mass and mechanotransduction. So oxytocin influences muscle satellite cells. Men lose muscle mass, what we call sarcopenia, faster and earlier. That means there's more room for oxytocin to restore function. Women retain muscle differently. They have less of a dramatic effect of the muscle loss, and then would have less of a rebound of muscle regain. So we're not going to see that change as much in those ways, but those are very important because, as we all know, lean muscle mass helps everybody out tremendously.
That makes sense. Could you maybe elaborate on what satellite cells are for muscles? I haven't come across that term before.
Yeah, it's just a reference to the cells that help direct muscle cell health, right? Just like you have support cells in the brain, every group of cells has their satellite cells, just the cells that direct like what should go on. Well, let's see.
Interesting. I didn't know that those existed. So there's a support system around a certain bodily system. Is that right?
Yeah. Well, and I guess in the easiest way to say it is they're just adult stem cells that hang out. And when something's not going right, like let's say you tear a muscle and then you need to bring more muscle in, then that quiescent adult stem cell comes in and says, "Hey, I will become a muscle fiber that will split, right?" And it hangs out what we call the basal lamina, so at the basement membrane. So that's why, like for example, if you get sun damage and the cells close to the surface get too much damage, and then of course you have your basement membrane. There will be cells there, and if you get damage all the way down to the basement membrane, the cells next to it will fill in. Well, some of those are stem cells of a sort that they'll go, oh, I will go in and divide and become two cells, and I'll fill in that hole. So then you have a basement membrane that keeps making a layer of new cells to then become dead cells.
Yeah. I see. So they're just kind of like they're muscle cells in waiting.
Exactly.
Just hanging out in the muscle lobby.
Right, exactly. Like they're the teachers that are the fill-in teachers, right? They're the their job is to I'm on call, I got to go. Yeah, exactly.
Gotcha.
Yeah, and you need lots of those. You have those in your arteries, you have those in all your cell layers, right? So
okay,
all right. So, yeah, no, it's important to kind of go. Oh yeah, you forget that we have stem cells everywhere, and there's so much talk about stem cells and like which level of stem cell is it? These are stem cells that can only become muscle cells. They couldn't become an artery or couldn't become a neuron or something like that. So they are very specific. So they're very down. They're potent, but not totipotent, and maybe not even pluripotent. They're stem cells that are, as you said, muscle cell in waiting.
Hey, sounds good. Yeah.
Okay. So and we know what those, and then that's kind of falls into the next part of mitochondrial aging differs between the sexes. Females have slower mitochondrial decline, and they have superior autophagy, right? In other words, their cells, when it's time to die, they just die. Whereas the guys, they don't have as high of autophagy. Their cells, right? And of course, we do fasting and stuff to set that off because we want to force that autophagy so that then these stem cells or these satellite cells will jump in and take the place of, and they're newer, they're healthier, and they'll replace cells that may have been kind of slightly going bad. But also women have more robust antioxidant pathways, refer back to estrogen and estradiol. So the drug combo may fix a problem males have from their genetic disposition, but females don't, right? Females already have a protective mechanism here. So the bottom line really is that the therapy didn't fail in females. It just was better at addressing a very specific male aging vulnerability. And this also, and I don't think they got to see all the benefits of the females because, of course, initial studies are always that they might not have looked at enough factors. They didn't look at, like, say, what was the autoimmunity in those mice? How did the immune system function? There's only so far you can go in some of these things. So that's where I would expect that as a follow-up that these researchers will find, actually what we saw with this was that we saw autoimmunity downregulation. Okay, so the bottom line is the therapy didn't fail. And this all really matters for osteopathy. And let's talk about that some. Let's really explore that more than we already have. So how
sure, I was going to just say, before we go on, I would just say, so this study was designed for male mice. They were looking for like effects in male mice, and maybe they just use females as a control, or I don't know, something to compare against.
No, they just included a set number of male and female mice. They were looking at mice in general.
Okay.
Yeah, and
All
so
right.
then
So
when they were
they
measuring
were
these,
just surprised.
right? So then they say, okay, what did when you take down all your information about, okay, which subject of this subject 151 is a male, it's this, it's this, it's this.
I
Here's its
see.
genetic line, blah blah blah, and then the female, and you go, okay, when we measured this, 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 and this, what did we see? And then they notice, gee, all the males tended to have the, or a majority of the males had this improvement, and the females, it didn't really shift them that way. So
Yeah, in aggregate, sure.
in aggregate, right?
All right,
Exactly.
cool. Yeah.
Okay.
All
Okay.
right,
So
I'm looking forward to seeing how osteopathy fits into all this.
yeah. So, and it kind of is back to the information that I like to put out about the three signals of health. It's a framework I already teach. Understanding that biomechanical, biochemical, and bioelectrical systems or signals are all part of the same system, right? So that just because a system is coming biomechanically doesn't mean that it doesn't have a biochemical or bioelectrical effect, and vice versa. The biochemistry, inflammation in this case, can deteriorate biomechanical and deteriorate bioelectrical so that nerves and muscles won't function through chemistry. And then that's where the fibrosis comes in, or some of these other problems that the male mice had. So the oxytocin and the ALK5 treatment affected biochemical and bioelectrical signaling, right? But osteopathy influences those same systems through mechanotransduction, fluid dynamics, and neurohormonal regulation, as we talked about. So the osteopathic diagram in fluid for work and fluid regulation and to lower TGF beta activity is for example, TGF beta is escalated in states of chronic fascial stiffness, low lymphatic flow, poor venous return, and low interstitial mobility. And interstitial is between the cells. So if cells and cell layers don't move independently of one another, they can't get fluid to flow through them. So they don't have good biochemical processing. They don't have good biochemical information. And this is when inflammation sits on the cells and ages them faster than they should really age. And some of the things that we do to address that, make sure the diaphragm works properly, make sure that the ribs pump appropriately, right? Thoracolumbar ring mobilization. So making sure that that whole ring, that the person's not only able to move, but they're able to breathe, and they get enough volume of oxygen that they can. I love to say this because it pushes people the wrong way in some ways. That people have to burn chemicals that are in their body, right? We add oxygen. Burning is called adding oxygen to something. So when we have these chemicals, these waste products of cell metabolism that have been building up in the system, we need the diaphragm to drive them back into the circulatory system. And then that's when you need your lungs to add oxygen to those chemicals and break them down. So we need to burn them. Well, if you don't have a diaphragm and a chest that work appropriately, you can't pump the fluid. You can't absorb the lymphatic fluid across the diaphragm. If that's all not working, you have big problems.
Yeah.
Plus that biomechanical.
Sorry, I was gonna say, could you just elaborate on what the thoracolumbar ring is?
So the thoracolumbar ring is really T10, 11, 12, kind of L1, 2. Well, in actuality, it's really T6 through like L2, L3. The diaphragm attaches to the ribs in the front from T6, the T6 ribs, all the way down to the spine. It really inserts at T12, but every level, T6, 7, 8, 9, 10, 11, have an effect on it. Then the diaphragm is inserting on that spine in the back, or in the anterior aspect of the spine, but it goes down all the way down to L4 on the right. So it tells you that this diaphragm is a huge area, and it's not just a ring straight across. It's a ring at an angle. It has a slant to it because and that diaphragm pumps fluid more at an angle. It doesn't do it straight up and down. It's not like you would think like, oh, it's just transverse or goes straight across the body and pushes up or down. This one's at an angle, so it pumps in a funny way. It really is designed to pump fluid to the back of the body wall, next to the spine, where it can be absorbed and taken up into repatriated into the circulatory system through the thoracic.
That's fascinating. So it describes how the diaphragm attaches to other points in the body.
Yes,
and it's described as a ring. Yeah, that takes up a lot of real estate.
Yes, it does. That's a big part of your body. So yeah, so it really shows you that there's this. The concept is it's a ring that functions, and that it really pushes a lot of fluid. So it draws air in by creating a vacuum in your lungs, but it pushes fluid on the other side. And so, most everyone's aware of the oxygen or the air part of that, but they're not as aware of the fluid part of that it's a massive fluid pump. And if that's not working right, if your chest and rib cage and the thoracolumbar spine are not working right, you don't pump fluid very well.
It's fascinating. And it can lead to, all those other things that you mentioned.
Right. So if you don't have the correct amount of oxygen, this is one reason that so many people find benefit in hyperbaric chambers, because the oxygenation is difficult because they don't breathe properly. So it's easy to have somebody sit in a room with high oxygen content, and that will force more oxygen into their system. And that's great. But that only works while they're in the room. What would be better is if they oxygenated appropriately at all times by breathing properly. So if the sternum let's say the chest is inappropriate, you don't increase your chest volume for air to come in. If you don't get that fluid out of the way, there's no room for the oxygen and the oxygenated blood and the healthy fluid to leak out of your arteries. So what happens, you have all this great fluid and oxygenated blood, and it's going by, and it needs to drop off. The fluid, the immune cells, the nutrients, the oxygen has to come out of the arteries and into what we call the interstitial tissue or fluid. It has to spread out among the cells. Well, if those are all backed up with used up fluid, then they just can't get off the train. The analogy is if a train pulls up to a train depot, but the train platform is completely packed with people, well, then you can't get the people that are on the train off the train. So therefore, no new stuff is coming out. You just have old used up stuff hanging around. And that's where and that's where this inflammatory signaling really comes from. Why the ALK5 is causing such a problem is because, you have a backed up system. So one of the biggest handles that we have as osteopathic manual therapists is to make sure that the person pumps the fluid, sucks in the oxygen, and does it efficiently, right? So if that doesn't occur,
very cool.
Yeah, the very baseline of biochemical functioning doesn't work, right? Organic chemistry is based on plentiful supply of oxygen. Well, if you're not oxygenating, your biochemistry is off. It's not organic chemistry. Well, inorganic chemistry is a scary place because all sorts of things happen, right? All sorts of cells can grow, et cetera, right? So, so thank you. Yeah, that's really good. Sometimes these concepts and you don't talk to to people who don't know about it. So
yeah, for the average listener who maybe doesn't have a lot of manual therapy exposure, this is really fascinating and great stuff. So I appreciate that explanation.
Yeah, no, thanks for bringing that up. So, and then all these techniques they're all to reduce stagnant inflammatory signaling. They're all to reduce stagnant inflammatory signaling, making the biochemical environment less aged, right? And that's the whole aging part of it. So chemically, you can push that with these chemicals that the researchers are looking at, and that's great. But natural, or what, as we say, endogenous hormones are even better at doing that. So again, back to the osteopathic manual therapy that, I'm not saying that there aren't people that are not going to be able to use these medications, but that the general public would do better to have osteopathic manual therapy.
Okay. And even if you're going to take the medicines, if you can't use them, kind of like we were talking about before, they could be there. You just can't turn the fluid over and you can't get that signaling to correct. And so you may not be able to access any benefit from the medicine anyway.
Exactly. Great point. Yeah. That's just it. If you can't get that medication off the train because of the same people hanging out on the train platform, well, there's nowhere to go. It's going to have very limited effect. You might get small amounts of it out, but it won't have the effect that we want to see. So, and so the researchers who are not doing osteopathic manual therapy to their mice, I can guarantee you, they just saw that effect with just giving them the medication. What if you had osteopathic manual therapy and that? First off, you might not need as much, and it would have a far greater and more in-line approach. Like you said, well, some females saw improved fertility. Why not all females? Why not all guys? Why not all males? What if we could spread this out and smooth it out and make it work even better? Would a double-handed approach, so to speak, or a double-pronged approach would be far better. So again, why we should do osteopathic manual therapy. Okay, so oxytocin is released through manual contact, right? When you hug, and especially like skin to skin. This is why so often when a baby is born, one of the things they want to do is they want to put it right on mom's chest, but it has to be skin to skin. And a lot of people don't always understand that or know that. They often put clothing between them and their kids or whatever, but actually the skin to skin contact is the most effective at that. So touch triggers measurable increases in oxytocin, vagal tone, and parasympathetic dominance, which is great because that means it decreases sympathetic dominance, which tends to tear you down. It's great for short periods, but you don't want to live like that. Now, manual therapy delivers downregulated cortisol, upregulated oxytocin pathways, and enhanced tissue repair states, right? So kind of what these two medications together were also helping with, right? This is essentially the manual version of what that drug combination is accomplishing chemically. So mechanotransduction alters gene expression, right? Osteopathic mobilization and stretch receptor input go go up into the vagus, the nucleus ambiguous, and it also has an effect on the adrenal gland. And this all causes an epigenetic shift. So it's not going to change the genes that you have, but it's going to change how you express the genes you have. So this is how fibroblasts change their phenotype. So fibroblasts can be productive, building fibroblasts, or they can cause fibrosis and overbuild and build structures that limit motion and limit function.
Is a fibroblast a type of muscle satellite cell?
It's a connective tissue cell.
Okay.
Yeah, so fibrous, so fibrinogen, which you need. You need that tougher connective tissue, not just muscle cells, but you need something that can make sure that the muscle cells have something to hold on to, like tendons, ligaments, all that stuff, so that and done appropriately, you're just rehealing the system that you go in, you work out, and you tear a certain amount of tissue, or you have you train for a sport and you have a certain amount of breakdown, and then you heal from that, or you get a sport specific increase in ability, and it's from these fibroblasts, right? They go in and they say, wow, look at this damage. And then the macrophages come in and say, wow, look at this damage. We should fix this up. Hey, fibroblast, why don't you do this and this and this and build that ligament thicker and make that tendon stronger and make, and help give this muscle a better place to attach, do this, that, and the other. And so then that's how these fibroblasts are part of the building team, right? They come in and say, yeah, let's make this place a really strong and healthy place. Or they come in and say, well, we're going to get into modern art here and have really weird constructs and stuff that don't help. Okay, so
gotcha.
Yeah,
and then just real quick, mechanotransduction. Just breaking that down. So you're using like stretching or pressure to
yeah. So
to send a signal across some distance to have some effect. Like you said, it affects epigenetics. Am I on the right path there?
Yeah. So mechanical. So you have sensory cells that, and then you have the slow adapting and fast adapting sensory cells that take in, like, did something hit you fast? Did something hit you hard? Was there a stretch? Was there a poke at your muscle? Was there this? Was there that? And it takes that information in and feeds it into the system. Now, for example, if your muscle stretches out, like if you stretch in the morning and you go, oh yeah, well, that feels good. Right. Because by stretching there, there was a mechanotransduction of information saying, hey, we stretched out, we got some nitric oxide produced, and we squeezed out some fluid, and then that causes a happy feeling, and your brain and your hormonal system and your autonomic nervous system go, yeah, we should do more of that. Hey, we should stretch out. That feels good. And then you're like happier, if you've stretched out or you've kind of gotten a little stretch, you go, oh yeah, I'm ready to face the day. I'm ready to go. That whole process is mechanotransduction. It's really showing you exactly how that all works. And that changes your attitude, that changes your hormones. And ultimately, by changing your sympathetic load, that has epigenetic changes, because if you do that all the time and you have that motion and you feel good, and say you go for a walk and you have good arm motion and good hip motion and good leg motion, that feedback into the system, the mechanical feedback into the system, drives your hormonal system to put out hormones like vasopressin to tell you, hey, we're happy, we feel good. If you have fibrosis and inflammation and all this other stuff, that doesn't happen. And then, we've all passed the grumpy old guy. Might have been me you saw on the street. But yeah, if you're stiff and he's walking along and he's got a scowl on his face, right? Who doesn't? When you're in pain, you're gonna have a scowl on your face. You're not gonna feel good. It's hard to be happy when you're in pain or even just this chronic discomfort. So it's a really odd thing that mechanotransduction, and of course, like osteopathic manual therapy, that's what we do, is we change how muscles and tissues and joints, nerves, arteries, organs, work together and what kind of mechanotransduction signals they're sending into the system. That's how we're able to affect neurohormonal output. That's how we're able to affect sympathetic tone, parasympathetic tone, and make them modulate more appropriately. So yeah, it's definitely a handle into the system that we connect into just by understanding the structures and what it is they're doing. So it's a very valuable bit of information.
That's so cool.
Yeah. Okay, so then that also changes how collagen is reorganized, right? Also, the mechanosensitive ion channels regulate inflammation. They'll let more ions in or out, and that helps flush fluid out. For example, in your kidneys, right? Is mostly we're talking about in your kidneys, in your lymphatics, in your like in the basement membranes. Like what's going on, and what should happen? Does it go more towards disorganization and dis-ease, or does it go more towards health and organization? So oxytocin and ALK5 change the biochemistry. Osteopathic manual therapy changes the biomechanical environment that controls biochemistry, that feeds into biochemistry. So we have a handle into that. And again, back to the biomechanical drives biochemical, drives bioelectrical, drives biochemistry, drives biomechanical. There's just this big loop of interconnectedness that those three systems, your body uses that. All bodies, all mammalian bodies use that signaling to drive health, to drive survival and thrival. Okay, so why men may benefit more from manual therapy in aging? Well, men have higher fascial density, more fibrotic aging patterns, higher transforming growth factor beta signaling, lower baseline oxytocin. Even though they're more sensitive to it, they have lower baseline oxytocin levels. So this suggests that osteopathic care might actually produce a larger anti-aging benefit for men, paralleling the mouse study. Women will benefit strongly too, but maybe via a different axis. Better autonomic regulation, better endocrine resiliency, better mobility and chronic pain modulation. So really improved quality of life, if not improved quantity of life for women. So the sex differences matter, and the longevity world is just beginning to catch up. And the sex difference, the sex-based treatment for patients is just trying to catch up, going, hey, we have to treat patients based on what kind of system is they're in, right? Are they in an estrogen dominant system, or are they in a testosterone dominant system? And what does that mean for their biochemistry, their bioelectricity, and their biomechanical states? Okay, so no one should assume that oxytocin and ALK5 will extend human life 70%, because remember, it extended the mice's life by 70% after they were already 75. So you're not going to have like 150 years here. Sorry, folks, or 130 or whatever. But the direction of the science is clear. Aging is modifiable. Systemic inflammatory noise is reversible. Tissue repair pathways can be reactivated. And osteopathic therapy helps the immune system. It helps the health system. It helps synergize with biochemical longevity treatments. It reduces the need for aggressive pharmacology. It extends functional lifespan through fluid and fascial regulation. It helps differentiate how men and women should age optimally. So longevity is no longer solely about the liver, the heart, or the brain. It's about systems integration. Can we make it all work together well? And that has always been the osteopathic worldview.
Yes.
Okay. So really,
it's the key. It's the key differentiator that makes OMT so valuable and so worth integrating into your healthcare regimen, for sure.
Right. Exactly. And for those therapists out there that are listening to this, I mean, this is really what you need to tell your patients. Like, look, ages ago there was an ad on the TV that said, BASF, we don't make the things you use, we make the things you use better. And that is osteopathic manual therapy. That's what we do in our classes. That's what we're focused on. How do we make people signal better on very baseline biochemical, bioelectrical, biomechanical means that our ability to get through to that system is a mechanotransduction system, and that causes appropriate hormonal signaling, proper fluid use, functioning, proper fluid use, functioning, and how to get rid of bad fluid, how to deal with inflammation. That's our whole goal in there. Okay,
this is reminding me of several years ago. You and I have a colleague, Neil, from Australia, and they were sharing in class one time years ago about a study that was done with men who lost their wives in childbirth, and the baby survived. And they were talking about how the men that did skin to skin with the baby didn't reject the babies, they had better mental health, and they were usually able to overcome the loss of their wife. And the ones who didn't do skin to skin didn't. And a lot of times they just couldn't function as dads, or even in life, because they didn't have that. And that's just, that, you know, mechanotransduction, or even just that, like that hormone there, like, but that's physical touch. Sometimes that's just a huge thing that's lacking. And, you can't get that. I don't know. We see patients all the time that take drugs and pharmaceuticals and stuff. And yes, that changes the biochemistry, right? But somehow that biomechanical, that's not easily done. And it has to be done in an educated way. And that has a really cool way of like jumpstarting the other two.
Exactly. Well, it's a little bit like taking vitamin 3 or vitamin D. You can take vitamin D, or you can go out and be in the sun. One of them is way better and longer lasting for you, right? There's the more natural way, or you can supplement, and supplementation is helpful, but it's not nearly as good as being in the sun. And the same as you said, skin to skin contact with a baby, and then that ability to get over the loss of a loved one, like a wife, who might be the only other person that this person came in skin to skin contact with, right? And men don't need that as much, but they need it some. And then they go from some to none, right? You can understand how that would have an effect on their mental health, their physical health, et cetera, et cetera. So you're right. It really does show you just how powerful these hormones are, and how being human is a very specific state that, sometimes modern medicine is so busy trying to remove humans from the human state that they kind of miss the whole point of how do we treat humans. And that's why, like, osteopathic manual therapy, we are actually part of the healthcare world. We are not a disease treatment model. We are a health delivery system. And that's an entirely different thing. And really, for patients out there, that's what you're after. You're after health delivery, not after disease treatment, because we all need disease treatment, but that's a small window of what we need, because either you die or you survive. And if you survive, it would also help to improve your survival rate. But if you're going to survive it, you also want to then, regain your quality of life. And like the study showed, women or females, you're going to regain quality. And then men, you're actually going to regain quantity and quality. So pretty important stuff.
You get to hang out with your cool wives longer.
Exactly. Exactly. So, in a lot of ways, with all this research coming out, and a lot of the backup of what osteopathy has been saying for over a century, right? We're entering a new era where manual therapy, molecular biology, and longevity science are no longer separate conversations. They converge. The Oxytocin and ALK5 study shows us that aging isn't fixed. Males and females may age differently, but they can both do so well. And that restoring fluid flow reduces transforming growth factor beta and activates repair pathways. And activating those repair pathways are key. And this is precisely the terrain that manual osteopathic therapy operates in. So if you enjoyed this episode, please follow OsteoSignal, leave a review, and send your questions for our next deep dive. Any other points you guys want to make?
Where would you like those questions sent? Do you want to just leave them in the comments below, or do you want them emailed? What would you like to do?
We can maybe have them probably email to me.
Okay, I can set up a mailbox.
Okay.
We'll just say questions at osteosignal.com. I actually bought that domain name, so we can do that. So if you want to leave your questions, send your questions to questions at osteosignal.com, and we'll review them for you, or Neil will anyway, not me. Right. I'm a dummy, so yeah.
No, those are some great questions. I don't think so. Yeah. So, well, okay. So until the next time, remember that health is not passive, it's signal driven, and you can change the signal.
Thanks for joining us on another episode of OsteoSignal with Neil D. O'Neill. For more information, please visit PursuitPT.com or PursuitPerformanceTraining.com. Our music was written and performed by Sky Toes. Copyright 2026 by Neil D. O'Neill.